delivering a life-saving dose to your front door.
Paramedics are bringing a COVID treatment right to patients inside their homes.
As TV5's Kendall Keys shows us, there's a need for it in mid-Michigan as numbers continue to go up.
We're preventing the emergencies from happening in the first place.
Normally, ambulances respond to an emergency and transport the patient to the hospital. Now, Medstar is delivering monoclonal antibody therapy to patients in the comfort of their home in Lapeer, Genesee, and Bay counties.
Monoclonal antibodies are something that is used for a patient who either lives in an environment where they're at risk of contracting COVID, or they've contracted COVID themselves and are fragile, medically fragile.
It's a treatment that must be prescribed by a physician. The monoclonal antibodies reduce the chance of contracting COVID and help fight it once contracted. But it's not to be confused with the vaccine.
It's really not a vaccine. It's a temporary measure that will build up your immune system.
How much of a difference can this treatment or therapy make in someone's chance of survival?
Of those patients who've received it, none of them have had their situation worsen.
Colby Miller, the CEO of Medstar of Michigan, says as more physicians become aware of this treatment, demand has skyrocketed.
When we first set the program up, we were probably getting a request every other day, every third day, maybe sometimes only once a week. Now, sometimes they're 10, 12, 15 a day.
Miller hopes the supply can keep up with the demand.
We're not there yet, but there may come a time when we have to prioritize who gets them based on their clinical situation or their physician's referral or whatever the clinical input is.
But Miller says an increase in demand shouldn't deter anyone from seeking a physician's referral for the monoclonal antibody treatment. Kendall Keys, WNEM TV5.